Hey everyone, welcome to our NCLEX RN review session on the Graves' disease with psychiatric presentation unfolding case study. In this session, we'll tackle 6 NGN test items, which are crafted to hone your clinical judgment skills and boost your exam readiness. Today, I want you to take advantage of the practice tests and share your score in the comments below. Let's get started. Here's the case. A 44-year-old female client visits her primary care provider with her partner reporting worsening anxiety over 6 months, initially attributed to financial stress and parenting an 18-month-old child. And here's the primary care visit details. She does not have prior thyroid disease, anxiety, which was diagnosed 6 months ago, postpartum 18 months ago, and no psychiatric history, not currently taking any medications, no allergies, and the current vital signs are temperature 36.8 degrees Celsius, heart rate 110, respirations 20, blood pressure 158/82, oxygen saturation 96%, room air. She lives with partner and 18-month-old child, works as school counselor, financial stress, and has social isolation. And there are no recent labs available, and currently she is independent but has reduced work productivity. Now your task is to highlight the clinical findings in the SOAP note that require immediate follow-up. So here's the documentation. It says, subjective, 44-year-old female reports a 6-month history of worsening anxiety, sleep disturbances, 2 to 3 hours nightly, 12 kilogram unintentional weight loss, palpitations, erratic behavior, placing books in oven, paranoid thoughts, believes phone sends secret signals to brain, partner reports irritability, reduced childcare capacity, no hallucinations or suicidal ideation. For objective cues, we have temperature 36.8 degrees centigrade, heart rate 110 beats per minute, respirations 20, blood pressure 158/82, saturation of 96%, room air, smooth, palpable goiter, none tender, fine hand tremors, lid lag, no thyroid eye disease, rapid speech, paranoid ideation, no overt psychosis. Feel free to pause this video so you can focus on the significant findings for this test item. When you're ready, let's get started with the rationals. Now, one of those items that you should highlight here is this one. Paranoid thoughts, believes phone sends secret signals to brain, right? And there's one at the bottom as well. So that's those two are gonna count as one. Now, the paranoid thoughts are a red flag. Even though the client does not have hallucinations or suicidal ideation, these paranoid delusions suggest possible psychosis, which could be disrupting or dangerous. And the key here is that this is not just generalized anxiety, because this one crosses into the realm of distorted reality. Whether it's caused by thyrotoxicosis or an emerging psychiatric condition, this needs urgent psychiatric evaluation, because psychosis is never something to monitor passively. The next one is 12 kilograms unintentional weight loss. This is a huge weight loss, especially over a few months. And in the context of a possible endocrine issue like thyrotoxicosis, this raises concern for a hypermetabolic state. And if left untreated, that could lead to muscle wasting, cardiac stress, or even a thyroid storm, which is a medical emergency. So this symptom definitely calls for prompt endocrine workup and laboratory testing. Next one is palpitations. Let's talk about the heart function here. And of course, with heart rate of 110 beats per minute and the client feeling palpitations, you're likely looking at a sympathetic nervous system overactivity, which is a hallmark of hyperthyroidism. And if this is left unchecked, this can lead to arrhythmias, hypertension, and heart failure. So yes, this is a high priority that requires immediate follow-up, especially when an endocrine consult and maybe even beta blockers for symptom control. Now let's talk about this one. Smooth palpable goiter. This is a physical finding classic for Graves' disease, which is the most common cause of thyroid toxicosis in adults. It's not painful, so we were less worried about the thyroiditis, but the presence of a goiter supports that this is a thyroid-related issue and very crucial to confirm the diagnosis. So this patient needs to start anti-thyroid therapy before complications can develop. All right, let's talk about the next manifestation that you should highlight, and this is fine hand tremors. This is another classic hyperthyroidism symptoms, and it shows increased adrenergic activity, also confirming that the client is in hypermetabolic state. So similar to the palpitations, the tremors are an early sign that you should push about checking the patient's TSH, the free T4 and T3, so this patient can get their treatment as soon as possible. Now let's talk about the items that you should not highlight, and one of those is 6-month history of worsening anxiety, and that's on the first row of the SOAP notes. So this one is concerning, but it's chronic, it's not acute. Even though it adds context to the patient's mental state, this one does not signal a new or emergent problem. So we are going to focus on what's new, what is escalating, or what is dangerous right now. And the anxiety is a symptom, but it's not paranoia. And the weight loss, the palpitations are the red flags that deserve the front seat right now, but not the 6-month history of worsening anxiety. Also, the sleep disturbance, 2 to 3 hours nightly. Well, we know that insomnia can be debilitating, but it's also non-specific. It's likely secondary to her hyperthyroid state and possibly anxiety or psychosis. This one should be addressed, but it doesn't carry the immediate threat that cardiac symptoms or psychosis do, so we're not going to highlight that one. Erratic behavior, which is placing books in oven. This is certainly concerning, but in terms of specificity, it's a bit vague because it supports cognitive disturbance, but the paranoid ideation is more clearly aligned with psychosis and carries a greater immediate risk. So even though this is important, but it's not the highest priority cue. Another is irritability, reduced childcare capacity. Well, this phrase right here reflects functional impairments, which are very important for the long-term picture. However, they're not medical emergencies, and they would be part of the care plan, but they do not demand immediate attention right now. Another is lid lag, which is another sign of thyroid toxicosis, but it's relatively mild compared to the tremors or the cardiovascular symptoms, even though it supports the diagnosis, but this one does not change the immediate management. So think of it as an accessory clue rather than a headline symptom. And for the vital signs, we have a temperature of 36.8 degrees Celsius, heart rate of 110, respirations 20, blood pressure 158/82, and saturation of 96% room air. These are already captured under the more alarming symptoms of palpitations. And the other vitals are relatively normal or stable, so they don't need to be prioritized. So what you're going to do here is to always look for what's actionable. Another is rapid speech, no overt psychosis, even though rapid speech adds to the psychiatric picture. But again, the paranoid ideation is a more serious finding. And the lack of overt psychosis gives more reassurance, but delusions are already present, and that alone needs urgent action. Let's talk about the phrase here. It says, no hallucinations or suicidal ideation. It's good that these are absent, but in the presence of paranoia, their absence does not make the situation less urgent. It just tells you what is not happening. So you still have to deal with what is. Another thing that you need to not highlight here is no thyroid eye disease. This rules out one possible complication of Graves' disease, but because there's no abnormal finding, there's no immediate action needed here. So it's just a supportive observation. So for you as the nurse taking care of this patient, you are expected to prioritize findings based on what poses an immediate threat to the patient's health or their safety. And in this case, your role is to recognize the red flags that indicate a client is potentially decompensating, either physically or mentally. And the correct answers should focus on signs that tell you if this is something that needs to be addressed right now, while the items that are not highlighted are more like, yes, they're important, but can wait. All right, you can pause here and reflect on your answers, and you can resume for the next item when you're ready. Let's have number 2.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
All right. It says the client is referred to the emergency department after thyroid function tests confirm thyrotoxicosis. Her partner reports she was asked to leave work due to erratic behavior. It says here in the nurse's notes, agitated, pacing, rapid speech, intermittent eye contact, paranoid thoughts, denies hallucinations or self-harm. Partner reports work dismissal due to erratic behavior. Temperature 36.7 degrees Celsius, heart rate 120, respirations 23, blood pressure 162/85, O2 saturation 95%, room air, smooth goiter, lid lag, no tremor, TSH less than 0.01 milliunits per liter, FT4 or free T4 95.2 picomoles per liter, and FT3 31.8 picomoles per liter. Now, your task is to indicate whether each symptom is associated with the specified diagnostic category. So we have the following symptoms on the left column, and the conditions: Graves' disease, anxiety disorder, and psychotic disorder. Feel free to pause the video and start answering when you're ready. Now, let me get started with the first symptom here, palpitations. What do you think with this one? Is this associated with just one or maybe 3? Well, one of the answers here is Graves' disease, because this is classic in that condition. So think of it this way: the patient's high thyroid hormone levels, especially for the free T4 and free T3. So these will crank up the patient's metabolism, and it will stimulate beta adrenergic receptors, and this can lead to increased heart rate, and that's why they have that palpitation. There's that racing sensation, and also the heart rate is 120 beats per minute. That's textbook for thyrotoxicosis. However, this is not applicable to even though palpitation can be associated with the anxiety disorder. But here's the key. In this scenario, the root cause is thyroid hormone excess. It's not just psychological arousal. And so when a client has objective signs like abnormal thyroid labs plus the tachycardia, the medical explanation is Graves. So that one takes priority. Now, talking about the psychotic disorder, this is not associated with that, with this condition, because palpitations are not part of the diagnostic criteria for psychotic disorders. And these conditions focus on thought disturbances such as delusions, hallucinations, not physical symptoms like increased heart rate. Now let's have the second symptom, which is rapid speech. This one is associated with Graves' disease. This symptom fits actually in all three categories. So let's just check all the boxes here. In Graves' disease, the body's engine is in overdrive. So there is going to be psychomotor agitation, including pressured or rapid speech, which is often seen. And the anxiety disorder, there is also pressured speech, which is the DSM-5 feature of generalized anxiety and panic disorders. When someone's mind is racing, so is their mouth. And in psychosis, you can see disorganized, rapid, or tangential speech, especially during acute episodes. So here, rapid speech overlaps across three conditions. Now let's have paranoid thoughts. This is applicable to Graves' disease, even though it might be surprising, but thyrotoxicosis can cause neuropsychiatric symptoms like paranoia. And it's not uncommon for patients in a thyroid storm or severe hyperthyroid state to have persecutory ideation, and also applicable to psychotic disorder. This is a classic sign because paranoid delusions are part of schizophrenia and related disorders. However, paranoid thoughts is not really associated with anxiety disorder, because anxiety usually involves worry or fear of negative outcomes, not fixed paranoid beliefs like I'm being monitored. So those kinds of thoughts fall more in line with the delusional ideation than anxious rumination. Let's talk about the 12-pound or 12-kilogram weight loss. This one is quite straightforward with Graves' disease. The patient has lost this much amount of weight because of her increased metabolism due to excess thyroid hormones. And weight loss is one of the hallmark signs of untreated hyperthyroidism. But for anxiety, it's not really associated with that. Sure, people with anxiety might eat less, but this kind of weight loss is too extreme for a generalized or anxiety disorder. So we're not gonna check that one. And the same thing for psychotic disorder. Weight loss is not a key sign of psychosis unless someone has severe self-neglect, like not eating due to delusions or extreme withdrawal. Weight loss is usually not present here, and that doesn't appear to be the case here. Let's talk about agitation and pacing, and this is evident in Graves' disease and also shared in the other two conditions, anxiety disorder and psychotic disorder. So with Graves' disease, there's excess T3, T4. It's going to increase everything, metabolism, their nervous system. So the patient often feel restless and agitated. And with anxiety disorder, this is going to be a hallmark manifestation, especially during panic attacks or high stress episodes. And for psychotic disorder, there's going to be pacing and agitation whenever there's schizophrenia, especially if the person is disorganized or reacting to internal stimuli. So agitation and pacing are non-specific, but clearly part of the three disorder profiles. Now let's have the last one, sleep 2 to 3 hours nightly. This is associated with Graves' disease because the client's metabolism is running full throttle, And this can lead to difficulty falling or staying asleep. And even with normal sleep hygiene, people with thyrotoxicosis often sleep poorly. And also associated with anxiety disorder, because insomnia is a core diagnostic feature of this condition. And there's going to be racing thoughts, tension that will prevent restful sleep. Even though with a psychotic disorder, yes, sleep can be disturbed in psychosis, but it's not a defining symptom. Because in schizophrenia, for instance, disordered thinking, hallucinations, and delusions are prioritized. Plus, this client has no hallucinations or self-harm behavior, which makes sleep changes better explained by Graves or anxiety. And so, let's move forward in this scenario. It says that the psychiatry team rules out primary psychosis, attributing symptoms to thyrotoxicosis, and the medical team initiates carbimazole 40 milligrams daily, propranolol 40 milligrams 3 times a day, and lorazepam 1 milligram as needed. She is admitted for monitoring due to psychiatric symptoms and thyroid storm risk. Let's get into our next test item.
Before moving ahead, here's something you need to hear if you're feeling anxious about passing the NCLEX, especially if you're aiming to do it in 1 week or 1 month. Then our complete online NCLEX review crash course is your answer. This is your shortcut to success, a tried and tested course with a 99% passing rate. More than 5,000 students have achieved their NCLEX goals using this course, and now it's your turn. Here's what's included. 100-hour animated mini crash course, perfect for last-minute preparation to pass in just 1 week. 300-hour comprehensive lectures covering 300 high-yield topics that the NCLEX loves to test. 5,000 real NCLEX questions. Train with real exam-style questions and be prepared for anything. 15 full-length practice tests, including CAT simulation. Build your confidence with realistic exam experiences. Exclusive NCLEX ebook and 1-year access. Study whenever you need without restrictions. Don't let this opportunity slip away. Enroll now at 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's jump into the topic.
Number 3, the client is monitored in the medical ward, showing reduced agitation and no paranoid ideation. Thyroid function tests indicate improvement, reflecting carbimazole category. It says here in the nurse's notes, and this reflects day 3, saying reduced agitation, no paranoid ideation, fewer palpitations, persistent fatigue, plans second pregnancy. And the vitals are 36.6 degrees Celsius, heart rate 100, respirations 18, blood pressure 140/80, O2 saturation 96% room air, free T4 60.5 picomoles per liter, and free T3 15.4 picomoles per liter, thyroid stimulating hormone receptor antibodies 6.2 units per liter, and technetium 99M uptake 17.8%. And the patient is currently taking the medications that I just mentioned. So you got carbimazole, propranolol, and lorazepam 0.5 milligram as needed. Your task this time is to indicate whether each action is appropriate for the specified care priority. And here is the matrix. So let's just go through the nursing actions here. One is continue carbimazole 40 milligrams daily, taper lorazepam to 0.5 milligram as needed, teach signs of thyroid storm, initiate risperidone for paranoia, schedule thyroidectomy consult, and provide community psychiatry referral. So you have the 3 categories there: thyroid management, psychiatric stabilization, and patient education. All right, let's get started here for the first nursing action. Continue carbimazole 40 milligrams daily. This one is obviously under thyroid management category. This is the first-line anti-thyroid medication, which will inhibit the synthesis of thyroid hormones. Since the client's thyroid hormones, FT4 and FT3, are still elevated, then continuing this drug is very critical to manage the thyrotoxicosis and also to prevent progression to a thyroid storm. So this one directly falls under thyroid management, which is the root cause of all her current issues. And the action is incorrect for the rest of the categories here. Even though treating hyperthyroidism may indirectly improve psychiatric symptoms, carbimazole itself does not act on psychiatric symptoms directly, so it's not going to belong to this category. And administering carbimazole is a clinical intervention. It's not an educational one. So if the item had said, teach about how carbimazole works, then patient education would be checked on here. However, it is not. Now let's go into the next action. Taper lorazepam to 0.5 milligram as needed. This one is applicable to psychiatric stabilization because we know that benzodiazepine, such as lorazepam, is a short-acting benzo. This is a good intervention once the acute agitation and paranoia have resolved. And your goal is to help reduce the risk of dependence, reduce the risk of sedation, while keeping it as needed for any remaining anxiety. And this action shows the clinical judgment needed in psychiatric stabilization. However, this action is incorrect for thyroid management because lorazepam does not act on the thyroid gland or the hormone levels, even though it may help temporarily control some symptoms like restlessness, but it's not a thyroid treatment. And also not going to match with patient education because this is a treatment decision. It's not a teaching activity. So unless the nurse is explaining why tapering is important, this doesn't qualify as education. All right, let's get into the next action. Teach signs of thyroid storm. This one, of course, belongs here. Patient education. When you're teaching the client to recognize early warning signs of a thyroid storm, such as high fever, severe tachycardia, confusion, or vomiting, this is crucial because she's still in high-risk phase, and this one empowers the client to seek urgent care promptly to fulfill the goal of promoting safety through education. But this one is incorrect for thyroid management and psychiatric stabilization. All right, let's move on to the next one. Initiate risperidone for paranoia. So here, we're not going to check the box here because, of course, initiating risperidone is already a red flag intervention in this context. Now, I want you to recall what risperidone is for. This is an antipsychotic drug that is used for schizophrenia or severe psychosis. And take note that psychiatry already ruled out a primary psychotic disorder, and her paranoid thoughts were linked to thyrotoxicosis, which is already being treated. And adding risperidone now could cause unnecessary effects like extrapyramidal symptoms or sedation, and it doesn't address the underlying problem. So it's not appropriate for any category. Now let's get into the next one. Schedule thyroidectomy consult. This one is appropriate for thyroid management because this is the next step for clients with persistent hyperthyroidism, especially in women of childbearing age. And remember, radioactive iodine is contraindicated in pregnancy, so surgery may be preferred. And this action helps establish long-term thyroid control and also a clear part of medical management. But this one is incorrect for psychiatric stabilization because the surgery has no bearing on mental health symptoms and not associated with patient education either, even though a nurse might later teach about the procedure. But scheduling the consult itself is not an educational task. All right, let's talk about the last one. Provide community psychiatry referral. And this one is appropriate for this one, or is associated with psychiatry stabilization. This one is a 2-for-1 answer, and rightly so, because it promotes psychiatric stabilization by ensuring continuity of care after discharge, which is very critical for clients with lingering anxiety or adjustment issues. And it also functions as patient education, because the nurse will explain why the referral is necessary and how to access the services and what to expect. However, this is incorrect for thyroid management because this action does not touch on hormone control or endocrine treatment. All right, let's go into our next test item, number 4. But before we go do that, it says here, the endocrinologist discusses treatment options, radioiodine contraindicated due to her child, thyroidectomy or medical therapy, and she prefers medical management with propylthiouracil if pregnant. Discharge is planned for day 2 with community psychiatry follow-up.
Before we move ahead, here's something you shouldn't miss. If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's continue with the topic.
Here's number 4. This is the day 4. We're discharging this patient. So these are the current medications the patient is taking: carbimazole 20 milligrams daily, propranolol as needed. And the nurse's notes on day 4 stated calm, no paranoid thoughts, sleeps 5 to 6 hours nightly, temperature 36.7 degrees Celsius, heart rate 88, respiration 16, blood pressure 130/78, saturation 97% room air, and the free T4 14.8 picomole per liter, and the free T3 4.6 picomoles per liter. Let's take a look into the provider's notes. It says, educate on medication adherence, agranulocytosis signs, avoid iodine-rich foods such as sushi, follow up with endocrinology, psychiatry, switch to propylthiouracil if pregnant. So here's your task to indicate whether each statement is appropriate for carbimazole discharge teaching. Here's the matrix. So you're going to select either appropriate or not appropriate for each statement. All right, let's start with the first one. Report sore throat or fever immediately. This one is appropriate. Remember, guys, that this is a possible complication. Even though it rarely happens, carbimazole can cause agranulocytosis. So according to the statistics, about 0.1% to 0.6% have encountered or have experienced agranulocytosis based on the available data. And so the severe drop in the neutrophil count increases infection risk in patients taking carbimazole. So the patient should watch for any sudden sore throat, even fever, because these may be the first signs of this dangerous complication. And your role is to instruct the client to report these symptoms right away to allow early intervention. Possibly there's going to be a need to stop the medication and to check their white blood cell count. Now, The main key takeaway for you regarding this statement is that anytime you discharge a patient using an anti-thyroid medication like carbimazole, always instruct them to report early signs of infection. This one is a textbook safety intervention, which is also aligned with the clinical judgment measurement model focus. And also this identifies and will manage potential complications for this patient. Let's have the second one. Take carbimazole at bedtime to improve absorption. This one is not appropriate because carbimazole does not have time-dependent absorption. It can be taken once daily, and what's most important is consistency, not timing. And so when you're telling the patient to take it at bedtime may conflict with their lifestyle. It might lead to non-compliance if they forget. So when you are educating the client about medication timing, you need to base it on the drug pharmacokinetics and the patient's lifestyle, but not according to assumptions. So the goal should be practical, should be sustainable, and this is one of the NCLEX that's going to look for. All right, let's talk about the next one. Monitor for jaundice or dark urine. This is appropriate because carbimazole can cause hepatotoxicity, even though it rarely happens. But when the patient has jaundice, if they start to have itching or dark urine color, these may signal liver damage. And when you are including this pieces of information during discharge teaching, this will help the client recognize early signs of liver injury to prompt them for urgent follow-up. So you always need to connect the side effects to organ-specific monitoring. And in this case, you're helping the client to act early to prevent irreversible liver damage. So also, this is a classic preventive teaching under the clinical judgment measurement model. All right, next one. Expect normal thyroid function within 1 week. This is not appropriate because carbimazole's therapeutic effect is not immediate, and this drug usually takes about 4 to 8 weeks to see the significant reductions in the free T4 and free T3. And so if you're telling the client that this is going to be normal in 1 week, is going to create false expectations, it can lead to frustrations and premature discontinuation of taking that drug. So you got to make sure that you are educating the client using clear, realistic expectations so that they will have better compliance in taking the drug therapy. All right, let's talk about the next one. Avoid seaweed and iodized salt. This one is appropriate because carbimazole works by inhibiting the thyroid hormone synthesis, and excessive iodine intake from seafood, let's say kelp, iodized salt, can override the effects. So it will worsen hyperthyroidism. And since this client enjoys or maybe can prefers to eat seafoods, then this teaching is client-centered and relevant for this case. And so in this scenario, always individualize the teaching to the client's lifestyle and their dietary habits, and make sure that you have to tell them to avoid intake of iodine to support pharmacologic therapy, which aligns with the clinical measurement model. All right, next, stop carbimazole if palpitations resolve. This is not appropriate because this is a dangerous advice. And just because the symptoms improve, that doesn't mean the underlying hyperthyroidism is cured. And so stopping the carbimazole too soon can lead to thyrotoxicosis relapse and possibly thyroid storm, especially in cases of Graves' disease. So here, your role should be to emphasize that symptom resolution does not equal disease resolution. And medications like carbimazole should only be discontinued under the provider's supervision. And once those TSH levels, the FT4 or the FT3 levels confirm control. because premature discontinuation contradicts the goals of sustaining the treatment effectiveness and also preventing relapse. All right, let's get into our next test item. But before we go to do that, it says here, the nurse educates her on medication adherence, signs of granulocytosis, sore throat, fever, avoiding iodine-rich foods, and she is advised to follow up with endocrinology and psychiatry with a plan to switch to propylthiouracil if pregnancy is confirmed. Her partner affirms that she has improved childcare and she plans a phased return to work.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
Let's have our test item number 5. A day after discharge, the client returns to the emergency department with chest pain, palpitations, and agitation, admitting she missed her first post-discharge carbimazole dose and ate sushi, misunderstanding dietary restrictions. It says in the nurse's progress notes, patient has chest pain, palpitations, agitation, missed carbimazole dose, ate sushi, and the following vitals are 37.1 degrees Celsius, heart rate 130, respirations 24, blood pressure 170/90, saturation of 94%, free T4 75.3 picomoles per liter, and free T3 20.1 picomoles per liter. Now I want you to pay attention to the lab results, comparing the one that you're seeing on day 4 at the time of discharge and day 5, which is the day after. So that's quite a huge of a shift between the values here. So your task this time is to complete the sentence by selecting from the options. And the phrase is, the priority intervention is to blank because the client blank. And here are the options. For options number 1, monitor airway and vital signs, refer to outpatient endocrinology, initiate risperidone for agitation, administer IV propranolol and hydrocortisone as prescribed. For the second blank, has elevated FT4 and FT3, consumed iodine-rich food, missed carbimazole dose, exhibits signs of early thyroid storm. Let's fill in the blanks. The answer here for the first blank is administer IV propranolol and hydrocortisone as prescribed. Why? This should be your priority because your patient is experiencing life-threatening thyroid storm. This is an emergency, and the patient complaining about the chest pain, the heart rate of 130, hypertension, she is agitated, and extremely elevated FT4 and FT3. Now, we want to review about the drug here. The beta blocker propranolol is going to control the patient's tachycardia and the hypertension and also the tremors. It will block the sympathetic effects of the excess thyroid hormones. Take note of that. Now, the hydrocortisone, which is a glucocorticoid, is going to reduce peripheral conversion of T4 to T3. And this drug supports adrenal function, which can become impaired during a thyroid crisis. And so the combination of propranolol and hydrocortisone is a standard emergency treatment for thyroid storm per the current clinical guidelines. Now, let's talk about the other options here that are incorrect. If you selected monitor airway and vital signs, yes, this is always part of your nursing assessment. But here's the thing. This is supportive. This is not therapeutic. And monitoring alone won't stop the thyroid storm. So you might say, of course, I'll monitor this patient's vital signs, but if you don't treat the underlying cause, their condition could rapidly worsen. So this should be eliminated as your option. Now, if you selected refer to outpatient endocrinology, this one's a non-starter because thyroid storm needs immediate hospitalization. And take note that referrals are for stable clients who can follow up later. Also, from a scope of practice perspective, nurses do not make outpatient referrals during emergency. So we're going to get rid of this. Another option, initiate risperidone for agitation. Again, risperidone is an antipsychotic, which is useful for schizophrenia or severe manic episode. It's not for thyrotoxicosis. And the agitation that we are seeing in this patient is a symptom of thyroid storm. It's not a primary mental illness. And so when you're giving risperidone, you're like treating the smoke, but not the fire. So this medication can also cause sedation in this patient and will also mask the worsening symptoms. So this can delay the proper treatment. Now, let's look into the next item here. Because the client blank, the answer here should be exhibit signs of early thyroid storm. This one captures the urgent clinical picture. It's not just that their laboratories are high. This person is actively decompensating. So you're looking at an endocrine emergency that can lead to cardiac arrhythmias, hyperthermia, delirium, even multi-organ failure. So your reasoning as a nurse has to be, I need to act now to prevent this from worsening. Now, why has elevated FT4 and FT3 incorrect? Even though these are skyrocketing values, but on their own, these laboratory values do not justify an emergency intervention because some patients have chronic hyperthyroidism and they have elevated hormones without going into a thyroid storm. And so remember that the key in NCLEX scenarios is to link those labs with the symptoms. Even though the FT4 and the FT3 elevation matters here, but the priority is driven by the clinical picture, which is early signs of early thyroid storm. So that should be your priority instead. Now let's talk about the next one, consumed iodine-rich food. Yes, we know that eating iodine-rich food such as sushi can trigger a thyroid storm, especially in patients with poorly controlled hyperthyroidism. But again, this is a contributing factor. It is not the reason for why you're taking emergency action right now. So you do not prioritize care based on what's caused the problem. You are going to act based on how severe the problem is at the moment. So that should how you think right now. If you selected missed carbimazole dose, well, we know that this is an anti-thyroid drug and missing a dose may have led to the worsening condition. But again, that's part of historical data. Remember that in NCLEX, it wants you to prioritize the client's current state, not speculate about what led them to the current condition. So this might be something you're going to educate on after the crisis has been managed, but this is not your immediate priority this time. All right, so let's talk about the sudden elevation of the thyroid hormone. So what really happened? Well, Go back into the scenario. The patient ate sushi, which often contains seaweed, and that's very high in iodine. And in people with hyperthyroidism like Graves' disease, this sudden iodine load can cause the thyroid to release even more hormones than usual. And in Graves' disease, the thyroid is already working overtime due to the autoimmune stimulation. And when an extra iodine is introduced, the overactive thyroid soaks it up and makes a surge of the thyroid hormones. So we got the T4 and T3. So it's like adding fuel to a fire. Now, why carbimazole cannot stop it right away, if that is your question? Well, remember that carbimazole blocks new thyroid hormone production, but it does not stop the release of hormones already made and stored in the thyroid. So when there is extra iodine available, the thyroid can still release large amount of hormones quickly. Now, if your question right now is how fast does this happen? Well, this hormone surge can happen within just about 12 to 2 days, 12 hours to 48 hours after they consume a high iodine food, especially in people with overactive or sensitive thyroid. And so just one sushi meal with a seaweed can contain several times more iodine than the daily recommended amount, enough to trigger a thyroid storm in this vulnerable patient. And so when you are going to choose a take action intervention, you have to make sure that you ask yourself if that option actively stabilizes the client's condition and if it prevents the immediate deterioration. And in this case, the intervention that is selected, which is IV propranolol and hydrocortisone, does that. And the other options are actually supportive, also irrelevant in the crisis, and also based on misidentifying the cause. Let's proceed to the next progression of our case study here. It says, suspecting early thyroid storm, the nurse gives IV propranolol, carbimazole 40 milligrams stat, and hydrocortisone 100 milligrams IV with airway monitoring as prescribed due to respiratory distress. She is readmitted for stabilization.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
Item number 6 is a bow tie question. It says, 1 week after readmission, the client attends an outpatient endocrinology follow-up. And the clinic visit details that the patient's current medications include propylthiouracil 100 milligrams daily, propranolol PRN, no palpitations, normal appetite, 7 to 8 hours sleep, no psychiatric symptoms, part-time work, temperature of 36.6 degrees Celsius, heart rate 80, respiration 16, blood pressure 125/75, oxygen saturation of 98% room air, free T4 13.2 picomoles per liter, free T3 4.2 picomoles per liter, the TSH level of 0.1 milliunits per liter, normal LFTs, and the provider note said psychiatry discharge, continue medical therapy, monitor for pregnancy. So your task is to complete the bow tie by identifying the primary goal and 2 primary actions or priority actions to achieve the goal, and 2 parameters to monitor to evaluate goal achievement. So here are the options for the primary goal. We have manage fatigue, enhance social functioning, prevent thyroid eye disease, prevent psychiatric relapse, and maintain euthyroid state. For the primary goal, you should select maintain euthyroid state. So here, think of this as keeping the thyroid just right, not too fast, not too slow. And the client's thyroid levels are now within the normal range. So look into the FT4 of 13.2 and the FT3 of 4.2. So the TSH of 0.1 milliunits, it's low, but expected and treated hyperthyroidism. So this client had a dangerous thyroid storm before, and our main goal is to keep her euthyroid, or making sure that she's in balance. And if her thyroid hormones spike again, she could end up back in that life-threatening state. And also, maintaining euthyroidism helps resolve those secondary symptoms like anxiety, mood changes, and also supports her pregnancy plans, which are especially sensitive to hormone changes. So the rest of the options are incorrect. And if you selected prevent psychiatric relapse, well, the symptoms that she had previously, agitation, paranoia, were caused by her hyperthyroidism, and they have resolved now, and that her thyroid levels are normal. And yes, it's important to be aware of them, but it's not the primary goal this time. So if we keep her euthyroid psychiatric symptoms, so let's talk about the incorrect options here. Let's say prevent psychiatric relapse. Well, the symptoms that she had experienced before, the agitation, the paranoia, all those were caused by her hyperthyroidism, and they're now resolved when her thyroid hormones are within the normal range. Yes, it's very important to be aware of the lab values, but it's not the primary goal this time. And if we keep her euthyroid, then the psychiatric symptoms are unlikely to come back. Now, the next one is prevent thyroid eye disease. Well, she doesn't have symptoms like eye bulging or double vision. And the thyroid eye disease is a possible future complication of Graves' disease, but it's not present right now, so it's not something we prioritize this time. If you selected enhance social functioning, well, she's already doing well socially. She's working part-time and spending time with family. And this one tells us her thyroid and mood are under control. And social functioning is great to monitor, but it's more of a secondary outcome. It's not the main clinical goal. The next one, manage fatigue. Fatigue was present during her thyroid storm, but has since improved once her hormones normalized. So again, it's a symptom. It's not the root issue. So if we control her thyroid levels, the fatigue tends to improve on its own. Now let's move into the priority actions, and the options are continue propranolol daily, monitor for signs of thyroid eye disease, initiate group therapy, refer to pain management, monitor for pregnancy and adjust medications, and reinforce propylthiouracil adherence. The 2 answers here includes this one, reinforce propylthiouracil adherence, because the last time she skipped her medication, that carbimazole, she ended up in a thyroid storm. This time she's now being prescribed with propylthiouracil instead, because she wants to get pregnant, and PTU is safer in early pregnancy. So your role this time is to educate her on the importance of not missing any doses and to help her build routines to stay on track. And this one is a very simple action that prevents life-threatening situation. The next one is monitor for pregnancy and adjust medications, because since she's trying to conceive, we need to keep a close eye. And PTU is safer in early pregnancy, but treatment might change later. And also, pregnancy can mess with the thyroid level, so we need to monitor frequently and adjust the medications as needed and as prescribed. And we know that this can protect both the mom and the baby. Now, if you selected refer to pain management, which is incorrect, well, our client is not in pain. It's not a current concern. So this is totally irrelevant. And if you selected initiate group therapy, well, the psychiatric symptoms are resolved and she's been discharged from psych. And therapy is not harmful, but it's not needed anymore in this case. Now, if you selected monitor for thyroid disease, well, there are no symptoms and no signs, so there's no need to monitor this right now. So your focus should be to stay on keeping her thyroid in check, but not looking on complications that are not there. And if you selected continue propranolol daily, well, propranolol helped her when she had high heart rate during the thyroid storm. But now her vitals are stable with a heart rate of 80 beats per minute. So this one is only being used as needed. So if you are going to give this medication, well, this can cause the client hypotension and bradycardia. So it's not going to help manage the thyroid hormone production either. Now let's talk about the parameters to monitor. And the options are social engagement, weight changes, pain intensity, eye symptoms, psychiatric symptom recurrence, and thyroid function tests, FT4, FT3, and TSH. The answers are this one, thyroid function test and weight changes. So those lab values, the thyroid testing, are the gold standard. That's the gold standard for knowing if her thyroid is under control. And these tests will also guide in dosing the drug, so to help catch problems early. And since now she is using the PTU and she's planning pregnancy, there should be hormone monitoring, which is very important than ever. The next one is weight changes, because she lost 12 kilograms during her thyroid storm. And if her weight stabilizes or if she gains some back, it suggests that her thyroid is calming down and her metabolism is also normalizing. So this is a clinical cue that supports the primary goal. Now, if you selected psychiatric symptom recurrence, well, she's mentally stable right now. And psychiatric care has been discontinued. So unless new symptoms show up, we don't need to focus on this one. The same thing with the eye symptoms. She's not showing any signs of thyroid eye disease. So there's no reason for us to monitor this unless something changes. And the pain intensity is not part of the picture right now. And monitoring for pain doesn't tell us anything about her thyroid function. And for social engagement, well, she's already socially active. And even though it's great to see improvement in quality of life, this one doesn't tell us whether her thyroid hormones are in balance. So for this test item, you need to think about the root cause and the clinical goal. You gotta pay attention to the psychiatric issues, the fatigue, weight loss, were symptoms of a bigger problem, and that's because of the overactive thyroid. So the number one goal is to keep her thyroid hormone levels very stable. Everything else, like mood, energy, weight, pregnancy safety, follows from that one. So let's do a quick recap of what you just learned from this case study. So the focus is on recognizing the thyrotoxicosis driven psychiatric symptoms and also managing hyperthyroidism with the thionamide therapy and beta blockade, and also to address those thyroid storm risk and make sure that you're optimizing long-term euthyroid outcomes through patients' compliance to taking the medications and planning for the pregnancy. So for that test item number 1, that was a hotspot. You identified the critical findings in the thyroid toxicosis related psychiatric presentation that required urgent intervention. And for test 2, that was a matrix multiple response. In that item, you categorized those symptoms to differentiate overlapping thyroid toxicosis, anxiety, and psychotic presentations. For test item number 3, which was a matrix multiple response, in that item, you prioritized the interventions across thyroid management, psychiatric stabilization, and patient education. And for test item number 4, that was matrix multiple choice. In that item, you generated solutions, you developed targeted discharge teaching for carbimazole, considering the hyperthyroidism and the side effect risks. And for test item number 5, that was a close test item. And here you selected those urgent interventions to stabilize an early thyroid storm emergency. And that's why you selected the IV propranolol plus the hydrocortisone. And test item number 6, this was a bow tie. In that item, you evaluated post-treatment outcomes to ensure euthyroid stability and the readiness for outpatient care. So that's it for today. For more NCLEX preparation content, subscribe to our YouTube channel, click all the buttons, and share with your friends preparing for the NCLEX. Bye for now.